This session will feature discussion on OSH in the digital economy. To talk about securing safety and health of workers in the digital economy, we have with us Senior Specialist on OSH of the Decent Work Technical Support Team for East and Southeast Asia and the Pacific, International Labor Organization Regional Office, Dr. Yuka Ujita.
My name is Yuka Ujita from the International Labor Organization Decent Work Team for the Bangkok. First of all, thank you very much for inviting the ILO to speak at this important event. Thank you very much. And let me start to share my screen. Sorry, I have to go back to my screen. Okay. And let me turn off my video because my internet access is not very stable. Okay, and the screen now. Good. And the title given to me this morning is the Securing Safety and Health at Work in Digital Economy. And actually, digital economy covers a very huge area. And the 20 minutes is not enough to cover all the items. So let me pick up the following two topics and discuss about these two topics. The digital economy transformed the world of work, and unfortunately, it produced the new groups of vulnerable workers in terms of occupational safety and health and labor. And those workers we call the platform workers, digital labor platform. And actually there are two types of platform workers. And the first one is that the work are performed or carried out online, such as translation service or the legal service, financial service. And those workers, they're often called freelance. And the second type of platform workers is the location-based platform worker. Worker is carried out in person in specific location, such as taxi driver, the delivery worker, home service worker, care workers. And those workers, platform workers, has a lot of disadvantage on safety and health, and how to protect and promote their safety and health is the challenging. And the next item I like to speak about is the new OSH service in the digitalized world. We are seeing a lot of new technology and how to apply this new technology in our daily work. And the ILO has a lot of international labor standards and conventions, but at this point, we don't have any particular conventions to cover platform workers. Instead, we have the Homework Convention 177, and this convention covers the home worker and those who were carried out by a premise in his or her home other than the workers of the employer. And this convention can be applied to the platform workers. And also the Article 4 of this convention clearly set out the protection of those workers from the occupational injury and accident and disease should be secured. And other than this convention, ILO has almost 40 international conventions, and including the Occupational Safety and Health Convention or the Promotional Framework Convention 187, which was already ratified by the Philippines. And those conventions set out to cover all workers and all workplaces. So in any case, the platform workers should not be left behind. So what is the challenge? What is the problem? How can we cover those platform workers? the transformation of the world of work has a lot of, elements. And the first of the labor process. And it's not only the platform workers, we ourselves, our labor process changing or the changed drastically during this a couple of years due to the digitalized the world, right? Actually, we are participating in this Congress online, and they usually work from home because at this point, due to COVID-19, we are mandated to work from home. So I'm working online every day, right? So the labor process changed a lot. And what about the working hours? For example, according to the recent ILO's report, the freelance workers, their average assignment, the one assignment average, they work for the 27 hours per week. But usually the freelance workers has the multiple tasks at the same time, right? So in total, they are working more than 50 hours per week. And the taxi driver, Uber driver, their average working hours is 65 hours per week. And the delivery workers are the same, they're almost 60 hours per week. By the way, recently, WHO and ILO produced and launched a new global estimate on occupational injury and disease. And we found every year, 750,000 workers die from the ischemic heart disease or the stroke due to long working hours, more than 55 hours per week. So you see, the platform workers already at a very high at least. And the employment condition, because the platform workers, majority of those workers do not have the employment contract. Instead, they're largely regulated by terms of service agreement. That means they are not cannot access to workplace protections and entitlement. And most of the platform workers do not have social security coverage, including the health insurance or the work-related injury. And most of them are facing discrimination and harassment at work. For example, you see the taxi driver, for example, their abuse by the client is the verbal or the physical violence. And in addition to that, COVID-19 pandemic created another transformation of our work. Not only platform workers, but we ourselves are affected a lot. And the COVID-19 pandemic accelerated the remote work, telework. And this afternoon, this of Congress, we are listening to the new normal, NOSH risks in new normal. So I'm really looking forward to listening to the discussion this afternoon. Okay, so what is the challenge of the national NOSH system? The national laws and policies cover those platform workers. Do they cover all workplaces or do they cover all workers? Yeah, usually this is the new type of work. It's difficult to cover by the legal framework. And what about the compliance and enforcement system? Our labor inspectors are already, the capacity of labor inspectors adequate to inspect those platform workers, or what about their authority or their responsibility, how they can inspect or to visit their workplace to enforce the law and practices, right? And as I said, those workers lack the employment contract. Then the employer's responsibilities is not clear. Yes, and usually the employers are responsible to give information, train worker, and provide the PPEs. But without the clear responsibility of the employers, it's not clear who will provide training to the platform workers? And again, the reporting, recording, notification is the big challenge. So those workers, platform workers, are they required to report what and to whom and how? What kind of instance they have to report is unclear. And actually ourselves is still unclear, the appropriate system of reporting, record, and notification system. And this digitalized world, the digital economy and transformation of the work created a lot of new OSH risks. And working environment, our workplace or the platform workers' workplace changing every day, right? Then how we can ensure appropriate, safe, and healthy working environment for them? What about the temperature, the lighting, or the noise? Who and how can control their working environment? But this is the same to ourselves, because we are now working from home. Our working environment is appropriate. And what about ergonomics? For example, your kitchen table is appropriate for the working for 8 hours. So these are the existing risks, but the emerging risks due to the digitalized world and also COVID-19 pandemic. And the psychosocial hazards is the big issue. And now many people are focused on this stress and mental health caused by the long working hours or the stress increased by the digitalized world and the COVID-19 pandemic, and due to the work-life balance and also violence and harassment. And after this session, then they will talk about the mental health. So this is must be, we must listen to that session. But now I like to reiterate you the importance of the risk assessment. Even though those OSH risks are new and emerging, if we can carry out the OSH risk assessment properly, identify the new hazards, assess the risks, and control risks, we can overcome our challenges. So risk assessment is a key. Now, let me move to the new OSH service in the digitalized world. We are seeing a positive impact on safety and health workers in this new world of work. Obviously, due to the remote work and the teleworking, our commuting times are reduced. And many workers enjoy the greater autonomy and the flexibility in the organization of work. And this is very important because the studies said the main reason of the workplace stress is the lack of autonomy and lack of the control of their work organization. So this is very good news. And somehow the better work-life balance is available, possible. And some workers reported their motivation is increased, and as a result, the productivity and efficiency is enhanced. And also, we have the very, the high technology and innovation in OSH services, the first in information dissemination, using the digitalized tool. Yesterday, the afternoon session, we listened about the information dissemination and the training education in the digitalized world. And we learned a lot. And now the possibility of the information dissemination and the raise awareness is a lot of possibilities through the digitalized tools and technique. And as a result, we can reach out to the wider audience, the wider workers in the even in the remote area, right? And actually that we can communicate now. I'm sitting in Bangkok and you're listening in the Philippines. So this kind of reach out is the big advantage. And also we have a lot of new visual and digitalized tools. Last week, the 22nd World Congress on Occupation Safety and Health that took place in the digital setting, and the theme was the connected age. And there are a lot of sessions and discussions regarding the digitalized tool on occupation safety and health. For example, the workplace wearable, and now the AI, the robot and computer AI, they carried out the hazardous work instead of the workers. So to avoid the exposure of the worker to the hazardous work. So that's good news. And also a lot of tools digitalized. For example, the fatigue detection or the contact tracing. These digitalized tools is very helpful. And also now technology is enabled to use the more accurate simulation model. And for example, the simulation for the fire safety or the evacuation system is the very advantage for the emergency plan in the OSH management system. And remote services now available, and perhaps the cost of occupation safety and health service can be reduced. But still, we have a lot of challenges, and not all work process can be digitalized. For example, the construction workers should go to the construction site every day, right? And the infrastructure, the internet access, the mobile internet is not available in all of the world. So still, we have the lack of the access to the infrastructure, and individual capacity is not only the capacity, but the preference. Some workers prefer still the manual and the hard copy of the materials, right? And it's not only capacity, but we have to, think about those people, those workers who cannot use the digitalized tool. And the legal framework already we discussed a lot, and actually yesterday already we discussed, and this data security. And this is I need another session about the data security, but it should be a part of the legal framework and the practices. And then what we can do to secure the resilience of system in this changing world of work. The way forward include updating laws and regulations, right, to cover all types of work, all types of workers and workplaces, and the capacity enhancement of labor inspectors and OSH officers ourselves to provide appropriate service to those workers. But these two measures, it takes time. So what can we do immediately is to promote social dialogue at the national and workplace, because even though we don't have the appropriate law or the legal framework or the compliance mechanism, through the dialogue, through the conversation of the workers and employers, they can provide the necessary control measures against the emerging risks. So I like to emphasize the needs of the social dialogue, and awareness raising training for workers always necessary. And we will listen another discussion during this Congress. And again, risk assessment is a key, always the key. We have to carry it out, appropriate the risk assessment. So this is my last slide. In addition to the challenges and the way forward, we have to continue update ourselves. Look at your young workers, young people in your country. they are very good to catch up with the new technology and digitalized tool, but sometimes in my age, I'm left behind, but I have to keep update myself. So this is my end of my presentation. Thank you very much for your attention, and back to you, Chair. Thank you.
Thank you, Dr. Ujita.